Okay, good morning to you. 11 past 7 for the first time. There is transparency with Pharmac. We've learned something. The released options for investment list show 73 medicines yet to be funded. Should the government bite the bullet and invest in these life-saving and life-prolonging recommendations? Joining us now is the former director of the Salaried Medical Specialists Association, health commentator Ian Powell. Ian, g'day, good morning. Thanks for coming on the program.
Good morning, Duncan.
This is not some sort of pie-in-the-sky drugs, are they? I mean, these are tested, these are credible, these are working in other places.
Absolutely. They are tested in two different ways. There's a very rigorous process to begin with, and it should not be called a wish list. It's a necessity list. It goes through a process of approval. Are these the drugs that work for these various conditions, even before it gets to Pharmac, and Pharmac has its own experts looking at it as well. So it's thoroughly tested. It's strongly clinically advised that this is what these people with various conditions need. We should regard it actually as an investment in the quality of life, and also that makes good economic sense, because many of these patients will probably be dependent on other forms of treatment, less effective, or being monitored, which also costs money as well. And their conditions will deteriorate if they're not getting these drugs, most of them, and that will mean that will also cost the system as well, so it's not just good for patients, it's actually sounder economics.
Yeah, it is.
If you look at that list,
if you look at this government's been all about well-being. So they didn't want to just judge a budget on just money alone, but they wanted to see if it increased better health and better well-being, better mental health. I'll tell you what would increase better mental health and well-being for some of these cancer patients is to know that they get the medications and drugs that they need to keep them alive or prolong their lives. Nothing more would give them satisfaction than that, surely.
And sure, I agree completely, and getting it in a timely manner. I think that you cannot commit to well-being without actually committing to resourcing well-being, and in this case, drugs. These are drugs we can easily underestimate how valuable and how economically and how health-wise effective these drugs are. And so we should be right behind this. It is a small amount, as you indicated in your introduction. It sounds a lot, 400 million or 417 million. But, as you said, this is out of a total spend of around about 20 billion. So you've got to have some perspective, and it's very targeted. It's a targeted investment. Some of those drugs have been on a waiting list for approval for quite some time. I think of the 118 proposals, 39 of them have actually been submitted before, at least over 4 years ago.
See, people have died waiting for this.
Only 16 of these drugs are new.
Yeah, exactly. Now, some of those drugs, which are easily accessible and available in places like Great Britain, Canada, America, Australia, you name it, they're there. People have died. Hundreds of people have actually died waiting for some of the stuff to come online.
Yeah. Ultimately, I think it comes down to a failing of sufficiently attuned leadership in our health system that is not just this government, it's successive governments, and it's built up over time. As I said, only 16 of these proposals, strongly clinically recommended proposals, are actually new for the first time. The rest have been in a queue for some years.
Where's the political will for this? You see, because you see this government might give 40 or 50 million extra and they make a big deal of it. The National Party before then say, well, we gave 30 million. But that gives it some perspective now. When you need 400 million, 30 mil's not that much.
Especially when it's well researched, it's based on good data and research, and there's every reason to believe that these drugs will be effective, improving people's quality of life, improving their ability to actually be more productive if they are working at the moment, including their ability to return to work and make an economic contribution to the country. It's just common sense, Duncan, and sometimes we get a bit highfalutin in the health system, and common sense doesn't give the due, doesn't give the credit that's actually needed for it.
No, I think you've just hit the nail on the head. We need to cut out the crap and just get down to what works and what's internationally proven as well. We do appreciate your time, former Executive Director, ASMS Health commentator Ian Powell. We appreciate your time. 16 past 7. Isn't it a